Flashback to May 30th, 2002 in the village of Shibuya Village, Kakamega County, and an incident that left the community in complex shock and disbelief. That's when Jamin Muhobero beat the unthinkable. He slashed his pregnant wife to death and then went on to slaughter his 4 young children and 3 other family members. Now, J-Mo, as he's known in Shibuya, has been languishing in jail for the last 10 years. We begin a 3-part series, which we're calling A Cycle Unbroken. Here's K24's Kisumu reporter Baraka Karama with the first part.
On the 30th of May 2002, Shibuya village in Shinyalu constituency woke up in shock and grief. A man slashed to death his pregnant wife, 4 children and 3 other family members. The man then took a rat poison in an attempt to take his own life, but was arrested and taken to Kakamega Provincial Hospital. That man was Jamin Muhobero. 10 years later, we bring you the untold story of what exactly happened that fateful night and what might have led to the bizarre
Liberia's.
Welcome back. We now take a look at matters health. On your well-being, we focus on painful menstrual periods. And listen to this. More than 50% of women describe their menstrual cramps as severe, and some are so severe they can actually lead to infertility. Medical experts say the condition is treatable if one seeks medical attention in time. Let's get more from K24's health reporter Irene Chelangat.
Painful menstruation, otherwise known as menstrual cramps, is a condition that has commonly been termed as a woman's problem. The condition is characterized with sharp pains in a woman's lower abdomen that occurs when her menstrual period begins and may continue 2 to 3 days. Sometimes the pain makes it difficult to perform normal household chores or could even deter one from attending school for a few days during the menstrual cycle.
Some women may get it because of infection around the uterus, what we call PID, pelvic inflammatory disease, which is due to infection, will give us painful period.
Although the condition is most common among young girls, many normally tend to shy away from speaking out about it or even seeking medical attention without putting into consideration the side effects associated with the pains.
Most women will think that this pain is normal because it started when they were young and it will persist throughout their reproductive life until when we are investigating for other things.
A woman is more likely to experience painful menstrual cramps if she experiences excessive bleeding, her menstrual periods lasts 5 days or longer, she smokes cigarettes, if she has female relatives who have menstrual cramps, she uses drugs like implant. According to a gynecologist, Dr. Sami Chalo, in some cases the pain may be a symptom of endometriosis, which is referred to as abnormal growth in the uterus, whereby its cell is shed during menstrual cycle, and if untreated early, the condition may lead to infertility.
And these women usually experience very severe menstrual pains. They can start when they are young and they are destructive. Because they are out there and they are bleeding every month, they cause wounds, and these wounds causes adhesions, what we call adhesions. Structures tend to come together and adhere. They attach to each other, and this is what leads to destruction of the tubes and occlusion of the tubes, and this may lead to infertility.
If you're one of the millions of women who experience menstrual cycle disorder during your periods, this is what one has to do about it.
The diagnosis of endometriosis, we may not get it as a straight finding from scan or physical examination, but we can get it by looking at the structures of the pelvis by using laparoscopy. When you do laparoscopy, you can identify endometriosis. You can see the lesions, you can see where the patient has been getting the bleeding, and you can even assess the damage.
So what steps have you taken to ensure that you are on the right track if you are suffering from the condition?